So next, we're going to talk about the procedures and reference material included within the universal care section. I'm not going to go into necessarily a lot individually in these guidelines, as most of them, require specific treatment, but just kind of give you a brief overview of the last six sections here. So we'll start here, just simply with easy IO placement. Again, this is a skill is referenced in the kind of the IV protocols when to use it. This is simply just the procedure itself for doing that. The indications obviously in 1-03. As far as provider level, it's going to be somewhat dependent on service specific training, but in general, in a cardiac arrest situation, this is an AEMT skill. Otherwise, in non-arrest situations, it's a paramedic only skill. As far as, again, the procedure itself, we simply go through kind of the technique of how to use the IO, the different caps or different sizes that may be on the truck or in the equipment bag. For the most part, adults obviously are going to use a blue cap. Pediatric use pink. For larger adults, where we're using humeral IOs, there may be a yellow cap as well. Let's see here. Obviously, most commonly we're going to talk about using the tibial plateau, especially in children. The humeral head insertion site is an alternative in adults only. There are some other ones right now. I have included the medial malleolus. However, this site is just a last-ditch effort if for some reason the humeral or the tibial sites are not available. There's also some possibilities coming down the lines for the medial condyle of the femur and potentially other sites as well that may be included in the future. As far as 1-P2, which is our helmet and equipment removal, and I apologize, this is not updated here on the top number. There's a whole presentation or video that's already been placed that kind of goes through the actual removal process. But again, in general, this is to use for any sort of athletic equipment removal where you've got helmets and other sort of padding. And again, I won't go into this. There is a video link down here that will hopefully work in the electronic copies. If not, again, there is another video that I have posted in regards to the removal process right down here that you can use to actually link to the actual YouTube presentation. But again, if there's questions, I've got a whole nother presentation on that, and I won't go into it right now. Port access, again, this is a specific a procedure that you've got to complete specific training on, but this is for patients who have ports that are generally used for blood draws and generally in patients who have been or are being treated for cancer. You really need to have the kit on the truck to be able to access the port, and really it's kind of like the IO. It's only used in emergent situations, so again, cardiac arrest or patients that are crashing in front of you. And again, kind of just goes through the procedure and the technique for accessing and dressing the site. 1-04 is the, or I'm sorry, 1-P4 is the orgastric tube or OG tube placement. Most agencies are not going to carry the OG tubes to begin with, and this is really only utilized in situations where you have a endotracheal tube in place. Although some of the newer blind insertion airway devices, like the King LT, have a gastric port where this can be advanced through. But again, this is only if you're carrying the equipment on the truck and have been trained to place the tube. Apologize here. 1-R1 is just the start triage reference flow charts. And again, these are fairly standardized triage systems. First, the start triage for adults. and then the jumpstart triage for pediatric patients, again, patients that obviously will fit on a Broslow tape. And kind of, again, we'll get into that more whenever we develop a true kind of mass casualty guideline. And finally, there's the 1-R2, which is our kind of pediatric PEARLS guidelines. This will hopefully be updated to kind of provide more pertinent information and a little better format. But in general, with pediatrics, we can consider our pediatric patients any patient that can fit on a Broslow tape. Once they're beyond the tape, or greater than 36 kilograms, we consider them to be an adult at that point. And again, just some points to remember in there. Your kind of weight-based normal vital signs, and then also kind of some of the equipment for each age or weight category. And most of this should be on either the Broslow tape or on the PD sleeves on the agencies that we're using PD sleeves with right now. And again, I'm hoping to continue to update this and work with the pediatric emergency physicians to kind of provide you with a little more information as we go along. So, as always, if any questions or concerns, please feel free to contact me. Thanks.